Should we start? Yep. Let's call the Health Committee meeting to order, July 7th, 2015, 9:30 a.m. All members present except for Donna and Jed. Are there any public comments? Seeing none, we'll move on to the agency reports. Today, Jennifer is going to tell us about Veterans Assistance.
Good morning. My name is Jennifer Ingram. For those of you that don't know me, I am a Navy veteran, and I spent 4 years on the East Coast. That's where I met my husband, 2 children, live in Donovan, pretty cut and dry. I am very, very, very pleased at my job. I like what's going on in this little faction of my life. Actually, it's not so little anymore. It's kind of gotten big. We have grown by leaps and bounds since taking over in September 2013. On any given day, you know, there are days that I have 6 people waiting to see me just for advice on whatever it is that they can get out of the Veterans Affairs. And then, like today I've not been very busy at all. It comes and it goes. So since 2013, the office has added approximately 150 new clients. That ranges from application for VA health care to finding discharge papers, widow's benefits, grave markers, etc. Claims are huge right now. I have a lot of claims that are going on right now for service connection. Service connection, for the layman's terms, is if you've got an injury or received an injury while you were in the service, and the VA can look back and see, yes, this did happen, then they compensate you for that. In September 2014, the highest mobile medical unit started coming once a month. This is a huge, huge outreach thing for veterans, especially veterans that are older and can't get around very well, to come in and at least receive some sort of basic health care. I'm pleased to say that I was able to get it done. However, numbers are starting to slack off a little bit, and I would like to be able to see that rise a little bit. On a monthly basis, we are seeing 2 to 3 vets a month, and a few on a continuing basis. There is a lady veteran, a World War II veteran that lives just down the street here that comes in every month to get a B12 shot. Right now, I have 22 active claims that are in various stages of the claims process. A year ago, I had maybe 1 or 2, and at one point during the last year, again, I've seen a huge increase. There have been 37 active claims pending. 15 have had decisions made on them by the VA. 13 have had some sort of service connection granted to them, ranging from 10% to 100%. 2 were returned with the VA deciding that the injuries or ailments were not sustained or caused by military service. A little side note here, I had a gentleman from the Southland area. He is dying. End-stage cancer, comes in and sees me about a year ago. I didn't know my head from a hole in the ground and processing a claim. He says, I've been exposed to Agent Orange. I have cancer of everything. I don't know what's going on. Can you help me? I said, certainly I can. And of course, when dealing with government entities and agencies, it takes a long time. He thought he was going to die before ever seeing any sort of service connection. And in this, every couple of 2 or 3 months, he would call me up and say, hey, Jen, do you have any money for me to blow before I die? And it would be a joke between him and I. Have you heard anything on my claim? So I'd look it up, and of course, not any movement on his claim. Well, lo and behold, this is around Christmas time. Around the February time frame, I'm in looking at claims and this and that, and about 2 weeks prior to his decision, I wrote a letter to the VA, hey, we need to expedite this. This gentleman is on the verge of dying. Fortunately, he keeps defying the odds of his end-stage cancer. He looks better. He says he feels better than he's ever felt before being diagnosed with this. Lost 60 pounds. First part of February, I call him up. I have something come in my mail, and it's an award letter for this gentleman. He was 100% service connected and also received about $30,000 in back pay. This gentleman was living on Social Security and living on $13,000 a year. Now, every month he is receiving a check from the VA, tax-free, for $3,200 a month. That is my biggest success, but I didn't do it. He's the hero, not me. There's a breakdown chart showing what percentage of service connection was granted, and I'll give that to you, Troy, here momentarily. The approximate amount of pay and the annual amount of compensation each veteran will receive. Over the course of the year, the back payment amount is in total of $85,463.64. The annual amount for all awards coming into the county is $187,547.04. These are just out of my office. These are the clients that have just come in to see me of the claims that we have processed. I have been advertising on WGFA radio, and Carl Gerdvich has been kind enough to announce when the mobile medical unit comes to town. The flyers are posted also in local businesses and local newspapers. I am trying everything I know in my power to get the word out, not just for the medical unit, but for the things that I do here. And I will add something too. I think my office being moved from where the health department is now has been made a huge impact on the foot traffic that has been in back and forth here. And today I will be giving a talk at Heritage Woods at 2 o'clock on one of the VA programs called Aid in Attendance. Basically what that means is it's nursing home care or home health care worker if a wartime veteran meets the guidelines for financial obligations. And it's not only for the veteran, it's for his spouse as well. So any wartime veteran that fits the need can have some sort of stipend come into their account to help pay for their care. And basically it is nursing home care for wartime veterans and or spouse. I also walked in the 4th of July parade carrying the flag with the American Legion in my dress white. My kids handed out flyers for the commission. It's kind of hard. My kids, we fight back and forth. I have a 17-year-old and an 11-year-old, but they were glad to do it. They didn't fight me on it at all. And my goal is to continue to do community outreach, not only to older veterans, but to the guys and gals just getting back out of the service and coming back here in Clay County. Yesterday, while I was at home, I checked my email, and there was a letter, a sample letter of another VAC requesting service members that are recently getting out guns labels so I can make contact with them. And hopefully that comes to fruition. I wrote the letter and I sent it out yesterday. I have assisted approximately 7 families since the new fiscal year began for an approximation of $1,750. And what the financial assistance is that they have to meet certain guidelines. They have to be behind on their bills. Just dire situation, honorable discharge, that sort of thing. And then I help them. $250 is the cap per calendar year. And I'm able to help, a vet, not have to worry about getting their lights or their gas shut off in the middle of winter, just as an example. And lastly, the health department, volunteer services, and the commission have been working together when a need arises to help veterans. We have got an interagency thing going on. I think it has benefited all involved because there are certain aspects, like on D's for the elder, Luann, she's like, well, I was out here, but he doesn't know where his DD-214 is at. Can you help me out? Certainly. Not a problem. There's been a couple of instances at volunteer services where, the older folks are not understanding what the VA is wanting them to do, and I've called down to Danville or Hines or whatever it may be, either schedule an appointment or see if they do in fact have VA health care along those lines. If you are a veteran, a family member of a veteran, if you need assistance or a friend or anything like that, you come into my office, I'm going to help you. I'm going to try and help you as much as I possibly can. Within the guidelines and the realms of my powers. And if there's something that I don't know, I'll find out. And that's basically, you know, my report. Are there any questions? And like I said, I'm pretty proud of this. I've worked kind of hard to get to this place where with the commission. Today, later on, I will be having a budget committee meeting, and hopefully that goes well as well. If it's within my power or if it's beyond my power, one way or another, we'll figure it out. We'll get it done because that's what my job is. I don't care if I have to. I've gotten phone calls at home at midnight or 1 o'clock in the morning, whatever. If it's on the weekend, I can't help you, but I can get here Monday morning. So basically, here is or graphs and all that good stuff as far as that is concerned. And there is also a 2014, what I did for the whole year for the fiscal year in there as well.
We'll pass this around. Thank you.
Thank you.
That was good.
And like I said, if you guys know of anybody, young guys, old guys, my age guys, gals, and they don't know which end is up, send them to me. I will try and find out to the best of my ability. Thank you.
Thank you.
Thank you. Head back to the way. I'm knee-deep in paperwork, so thank you guys.
Iroquois County Public Health Department.
Good morning.
Good morning.
Well, the first thing that I'd like to talk about this morning is the summary report that I handed out to you. A lot about the grants and contracts that we have at the health department run on the state fiscal year from July 1st through June 30th. So a lot of these numbers are grant year-end numbers. So we've had a lot of audits at the health department over the last month. May 26th, we had our local health protection grant audit, and I let you know about that at the last meeting, but we hadn't received any kind of an official audit report back. I didn't bring the audit reports with me, but I would be happy to share them with you if you'd like. The local health protection grant audit report focused on food, potable water, and septic, and that audit scored a 99.98 out of the possible 100. So that was pretty good. June 10th and June 11th, we had our WIC and family case management audit and have received certification for a 2-year period of time rather than a 1-year period of time, which is really nice. They told us that they typically only give 1-year certification, but they were very impressed with the financials and the program. On June 12th, we had the Healthy Families Illinois audit. I have not received official documentation from that audit yet, but have been told that they were very, very pleased. On June 18th, we had our vaccine for children, our VOC compliance audit. That audit was done by the regional office in Champaign. They sent the vaccine preventable disease coordinator, Debbie Rose, to do this audit because it was a 1 year, or, a first anniversary audit, I guess you could say. Very pleased. We have not received a final report from her, but she did do an exit interview and told us that she was extremely pleased. On June 23rd, Luann had the Adult Protective Service Program had an audit from the East Central Area Agency on Aging. We don't have any final report from that, but Amanda Tim did do an exit interview with both Luann and I and told me that she was going to have a difficult time finding any findings. And then June 29th, we had our lead screening site visit from Roxanne Fleming from the State Health Department, and she was very pleased as well. The one thing that I do want to stress is I'm extremely proud of my staff. They have done a wonderful job. I think we surpassed the expectations of the auditors on our programs this year. I think that because we had to basically start a lot of these programs from scratch. New policies, new procedures, definitely new financials. Every auditor was extremely pleased with the financial record keeping. We're very complimentary of everything that Anita has done for us. And keeping track of the programs and the expenditures and the revenues separately, as separate line items, and not just one big pot of money that you had to sort through. They like the claims process of everything having to be approved, and then we track it so that each grant, we know at all times where we stand with those grant amounts. They were very complimentary and told us that our financials were much easier to read than they had been with the previous health department, and they were extremely happy. So we were very pleased. Two of the auditors sent letters, and I will forward them to the committee members if you wish, or I can bring them up in the next meeting, sent letters and told us that, and in the letters said that we had one of the finest health departments in the state. So I thought that was a big compliment. I had a Board of Health meeting on June 23rd, and the Board of Health approved a new monthly extension addendum to the IMH contract. We did not offer the contract with the 3 services that we subcontract with IMH. Contract ran out on June 30th, but we did do an extension addendum contract with them that the Board of Health approved based on estimated figures, because we obviously don't have a state budget, and until we have a state budget, we won't know those exact grant amounts. So I went to several meetings and gathered as much information as I could, and we gave it our best estimation at what those grant amounts would be according to the information we received from DHS. So we have that monthly extension addendum in place until the state budget is signed. I did, however, if you look on your grants and contracts list, I did, however, sign temporary contracts with DHS for those 3 programs. And they did give us an estimated figure amount for those, but of course they put in big capital letters in the contract that until the state budget is signed, this is the temporary funding. But we signed those contracts because that allows us to back bill services from July 1st on, because we were very concerned about the ability to be able to back bill if there was no signed contract in place. So they got those to us on July 1st. We had the dates on July 1st and returned them that same day in order to be able to back bill. Otherwise, the Illinois Department of Public Health contract, even though there's not a state budget, they've allocated our money to us and told us that those allocations will be honored. They have only given state IDPH contracts for those programs which they have on their priority list and know that they're going to fund. So the only one on the grant and contract list that you see that we don't have an allocation amount for is the lead grant, but we've been verbally told that that is, it will be funded, they just aren't sure of the amount yet. And like I said, Roxanne Fleming from the state was here on the 29th for a lead screening site visit and verbally went over with us what she thought our grant amount would be, and she thinks that ours will remain level and unchanged, but we don't have an actual contract with them yet, so I expect that to be coming pretty soon. The only other thing that I handed to you was an organizational chart. Our organizational chart did change a little bit. I did replace the director of nursing position, but I replaced it internally, and we have actually gone from 11 full-time and 10 full-time and 6 part-time staff to 11. We've gone from 11 to 10 full-time people, and from 5 to 6 part-time people. So one full-time person became a part-time person. And then we did some reorganization within the health department to fill that position from within. If you notice that the only grant that we don't have that we had last year on the grants and contracts list was the coordinated schoolhouse grant, and that was set statewide. So that position during the school year was 1 day per week and 2 days a week in the summer. So, and then our Illinois breast and cervical grant dropped approximately 25 to 26%. So that freed up some extra time to be reallocated to other staff so that I could fill that director of nursing position internally with Vonda Pruitt. She did meet all the qualifications, and the Board of Health did approve her.
Anyone? Questions? Thank you, Dee.
Thank you.
Has everyone had a chance to review the claims? Now we can take one more time.
Approve the claims pending county board.
Motion on the floor to approve the claims. Is there a second? Brett? Is there any discussion on the claims?
Schultz,
Yes.
Schmidt,
Yes.
Berkeley,
Yep.
Crumley.
Yes. Motion carries. Next item of business, old business. Anyone? New business? There's no new business to be brought before the committee. I would entertain a motion to adjourn. Moved by Dan, seconded by Brett. All in favor to adjourn, say aye.
Aye.
Opposed, same sign.